Over 60? Drink this to increase blood flow down there, and you might notice it faster than you think. I'm Dr. Julia Morgan, board-certified urologist, and I work with hundreds of men over 60 who want more stable mornings, better energy, and improved pelvic circulation without immediately jumping to medications. Today, I'll show you a practical, evidence-informed way to turn your morning coffee into a circulation and hormone support beverage using 5 kitchen ingredients. I'll explain the why, the how, safe dosages, a week-by-week plan, and what changes you can reasonably expect. If your mornings don't feel like they used to, type yes in the comments and tell me where you're watching from. I read these. Aging changes how you respond to fuel. 2 things happen that matter most. First, testosterone slowly declines, and second, your blood vessels lose some of their elasticity and nitric oxide responsiveness, that tiny molecule that tells vessels to relax and let blood flow freely. Add in years of diet, the way caffeine is processed in an older liver, and the small micro-injuries that high blood sugar spikes cause to tiny vessels, and you have a recipe for lower genital and pelvic blood flow and for mornings that feel less reliable than they did a decade ago. Think of your body like a classic car. The engine and wiring are still good, but after many miles, it needs higher quality fuel and more careful maintenance. A few small changes to that fuel each morning, simple food-based additions, can help stabilize energy, protect small vessels, and support the biochemical pathways that help with vasodilation and hormone balance. Many men notice more stable energy and better morning consistency within days to a couple of weeks. Improvements in sexual function or sustained erectile responses usually take a few weeks of consistent habits plus attention to sleep, exercise, and medications. Here's the plan. 5 ingredients: Ceylon cinnamon, unsweetened cocoa or cacao, maca powder, coconut oil or MCT oil, and a little ginger. Added to your coffee and blended into a creamy, emulsified drink. Each ingredient pulls its weight in a different way: blood sugar control, nitric oxide support, adaptogenic assistance for hormones, steady energy from medium-chain fats, and a gentle circulation boost. I'll walk through what each does, the evidence you can look up, starting dosages, taste tips, safety caveats, and a clear 4-week integration so you add ingredients gradually and safely. First, cinnamon. Use true Ceylon cinnamon, not the common, cheaper cassia. Ceylon has far lower levels of coumarin, a compound that can stress the liver in high amounts. Cinnamon helps moderate post-meal blood sugar spikes, has polyphenols that protect small vessels, and appears to help endothelial function, the lining of blood vessels that produces nitric oxide. The Mayo Clinic and several nutrition reviews note cinnamon's role in blood sugar management and advise attention to coumarin content. Start gently. 1/4 teaspoon of Ceylon cinnamon added to your coffee is a conservative beginning. If you tolerate it well, you can gradually move to 1/2 teaspoon daily. Taste tip: cinnamon pairs beautifully with unsweetened cocoa. It rounds out bitterness and gives a warm, spiced flavor. Patient example: a 58-year-old contractor I saw started adding a small pinch of Ceylon to his morning brew and said his mid-morning energy slump nearly disappeared within a week. He felt less shaky between meals and his workdays were more steady. Important safety note: if your cinnamon is cassia, the darker, common supermarket kind labeled simply cinnamon, it can contain significant coumarin. If you have liver disease or take medications that affect the liver, or if you're on blood thinners, check with your doctor before regular use. Next, unsweetened cocoa or cacao. Cocoa is rich in flavonoids that support nitric oxide production and endothelial health, and some clinical studies, referenced by journals like the Journal of Hypertension, show improved blood flow with flavonoid-rich cocoa intake. That's the same mechanism many heart-healthy interventions use. More nitric oxide means vessels relax and allow better perfusion to tissues, including the pelvic region. Use a high-quality, unsweetened cocoa powder, not a sugary, pre-sweetened mix. Start with 1 teaspoon in your cup. This gives a mild chocolate note without sugar. Cocoa also supplies magnesium, which helps muscle relaxation and mood. Taste tip: if straight cocoa tastes too bitter at first, mix that 1 teaspoon with the 1/4 teaspoon of cinnamon and a small splash of milk or plant milk, or add a drop of liquid stevia or a pinch of monk fruit if you need sweetness. Anecdote: a 54-year-old teacher I worked with reported feeling a subtle lift in mood and reduced anxiety around intimacy after adding cocoa to his coffee. That mood change helped him feel more confident in the mornings. Third, maca powder. Maca is an adaptogenic root from the Andes that many studies in men reference for supporting sexual stamina and hormonal balance. Journals such as Andrologia have published small studies suggesting maca may support libido and improve some measures of sexual function, though results vary and it's not a medication. Maca comes in different varieties. Yellow is the mildest and a good starter. Red and black maca are sometimes reported to have stronger effects for endurance and sperm quality, respectively. For most men over 60, I recommend starting slow. Begin with 1 teaspoon of yellow maca 2 to 3 times a week, mixed into your beverage. After 2 weeks, if you tolerate it and want to increase, move to 1 teaspoon daily, then up to 1.5 teaspoons if needed. Maca has an earthy, slightly malty taste that combines well with cocoa and cinnamon. Practical note: maca isn't a hormone, it's an adaptogen that can help your endocrine system find balance. Anecdote: a 57-year-old engineer who added 1 teaspoon of maca 3 times a week reported higher stamina doing morning walks and felt more motivated, which over time correlated with improved consistency in morning erections, an individual result, not guaranteed. Fourth, coconut oil or MCT oil. These are medium-chain triglycerides that provide quick, steady energy without the crash that can sometimes follow high-carb breakfasts. MCTs are used by the liver for rapid ketone production and can support cognitive clarity and steadier glucose responses. They also supply lipid building blocks needed for hormone synthesis. Raw marine or plant-derived cholesterol precursors are part of how our bodies make testosterone, and supporting that pathway nutritionally can be useful when combined with other healthy habits. Start very conservatively, 1/2 teaspoon of coconut oil or MCT oil blended into your coffee. Over a week or two, you can increase to 1 teaspoon if you tolerate it. Important preparation note: always blend or use a frother with the oil so it emulsifies into the coffee. Otherwise, it sits as an unappealing oil layer. The texture becomes creamy and latte-like when emulsified. Taste tip: coconut oil can add a mild tropical note. If you prefer neutral flavor, opt for refined MCT oil, which is flavorless. Fifth, ginger. Ginger improves circulation, reduces inflammation, and has antioxidant qualities that protect testosterone-producing tissues from oxidative stress. A small amount works as a finishing circulation booster. Use 1/4 teaspoon of powdered ginger or a 1/4 teaspoon equivalent of freshly grated ginger in the blend. Ginger gives a gentle warmth and helps the whole drink feel invigorating. Start with that small amount. If you tolerate it well, you can increase to a 1/2 teaspoon in later weeks. Now for the combined recipe I call the Spiced Mocha Vitality Coffee. Brew 8 to 10 ounces of your usual coffee. In your blender or with an immersion frother, add the following to the hot coffee in this order: 1/4 teaspoon Ceylon cinnamon, 1 teaspoon unsweetened cocoa, 1 teaspoon yellow maca, only after you've introduced it per the week plan, 1/2 teaspoon coconut oil or MCT oil, and 1/4 teaspoon powdered ginger. Blend for 20 to 30 seconds until creamy and emulsified. Taste, then adjust with a few drops of liquid stevia or a pinch of monk fruit if needed. If you like milk, a splash of dairy or plant milk softens bitterness. If texture is oily, your blender speed was too low. Blend a little longer. The result should be smooth, warm, and slightly chocolatey with a spiced finish. For many men, this is pleasant enough to become a ritual. Ritual matters. Taking time each morning to prepare a deliberate, health-supporting beverage reinforces consistency, and consistency is how small interventions become meaningful. Introduce ingredients gradually with this 4-week integration plan. Week 1, stick to your usual coffee, but add 1/4 teaspoon Ceylon cinnamon daily. Monitor how you feel and watch for any digestive changes or unusual symptoms. If you're on blood thinners or have liver issues, pause and ask your clinician first. Week 2. Add 1 teaspoon unsweetened cocoa to your coffee plus the cinnamon. You're now getting both blood sugar support and a nitric oxide-friendly flavonoid hit. Week 3. Introduce maca, starting with 1 teaspoon 2 to 3 times across the week, not every day yet. See how your sleep, mood, and energy respond. Week 4. Add 1/2 teaspoon coconut oil or MCT and 1/4 teaspoon ginger, blending thoroughly. By the end of week 4, you'll be comfortable with the full spiced mocha. If at any stage something feels off, gastrointestinal upset, headaches, unexpected bruising, or jaundice, stop and consult your provider. What changes should you expect and when? Many men report more stable energy and fewer mid-morning crashes within days to 1 to 2 weeks after regular use of cinnamon and MCTs combined with cocoa. That steady energy can translate into less anxiety around mornings, improved mood, and more consistent morning erections for some men. However, improvements in sexual function, reliable erectile responses, larger increases in baseline libido tend to emerge more slowly, usually several weeks of consistent use combined with sleep, physical activity, and attention to cardiovascular risk factors. If you're on medications like nitrates or have significant heart disease, any new beverage that changes your blood pressure or interacts with medications should be discussed with your doctor. Remember, individual responses vary. A quick realistic example I see in clinic. One patient began the cinnamon plus cocoa routine and within a week noticed he wasn't crashing after breakfast. That energy steadiness allowed him to be active during the day instead of napping, which improved his sleep at night. After 6 weeks of these habits, he reported both higher daytime energy and improved morning firmness on several days. That's the kind of cascade effect to expect. Small changes in one area can improve others. But I must emphasize that these are anecdotal reports from individual patients and not guarantees. Safety is critical. First, the cinnamon warning. Many supermarket cinnamons are cassia and have higher coumarin content, which can be harmful to the liver when consumed regularly in large amounts. Use Ceylon cinnamon labeled as Ceylon or true cinnamon and limit daily intake to the conservative doses I mentioned, 1/4 to 1/2 teaspoon. If you have liver disease or take medications that interact with the liver, consult your physician before regular use. Second, blood thinners. Cinnamon, cocoa, and ginger can all have effects on platelet function and blood clotting in some people. If you take anticoagulants such as warfarin, Coumadin, or novel oral anticoagulants, check with your prescribing clinician before making these additions routine. Do not stop or change medication doses without medical guidance. Third, diabetes medications. Cinnamon and maca may influence blood sugar and insulin sensitivity. If you're on insulin or oral hypoglycemic agents, monitor blood glucose closely when starting these additions and speak to your diabetes care team because adjustments may be necessary to avoid hypoglycemia. Do not self-adjust medication based on this drink. Fourth, allergies and digestive tolerance. Cocoa contains compounds that can cause reflux in some men. Coconut oil can cause loose stools in those not used to fats. Maca may cause mild GI upset at first. Start slowly and note how your digestion responds. If you have a known allergy to any of these ingredients, avoid them. Fifth, interactions and chronic disease. If you have cardiovascular disease, kidney disease, or are on multiple medications, this approach is meant to be additive to, not a replacement for your medical care. Consult your healthcare provider before making major changes, especially if you have unstable medical conditions. On the evidence front, this isn't snake oil. Clinical institutions and journals have looked at individual pieces of this puzzle. The Mayo Clinic provides guidance on cinnamon and cautions about coumarin content. The Journal of Hypertension and other cardiovascular journals have reported on flavonoid-rich cocoa's beneficial effects on endothelial function and nitric oxide-mediated vasodilation. Andrologia and similar journals have published small studies on maca and male sexual health, suggesting possible benefits in libido and sexual function measures for some men. The takeaway is that each ingredient has some scientific backing for the role it plays, but combined lifestyle factors, exercise, weight management, sleep, alcohol moderation, and medication optimization determine the overall outcome. Practical tips to make this sustainable: use a small kitchen scale or measuring spoons so you don't overdo anything. Buy certified Ceylon cinnamon in a resealable container and store it in a cool, dark place. Choose unsweetened, minimally processed cocoa powder. For maca, look for powder from reputable suppliers. Yellow maca is the gentlest starting point. If you're trying to lose weight or manage blood sugar, skip added sugar and use low-calorie sweeteners like stevia or monk fruit sparingly. Always blend the coffee and oil to emulsify. Immersion frothers work if you don't want to use a full blender. If you're on a tight medicine schedule or have bleeding disorders, liver disease, heart rhythm problems, or complex endocrine conditions, schedule a brief consult with your physician before starting. I recommend bringing a list of your medications and the ingredient doses you plan to use. If you are specifically concerned about erectile dysfunction, medications like PDE5 inhibitors are established treatments with known efficacy. What we're discussing today is supportive nutrition that can complement medical therapy and help address underlying factors like endothelial health and steady energy. Let me summarize a few real-world dosages so you have them in one place. Start with 1/4 teaspoon Ceylon cinnamon daily, 1 teaspoon unsweetened cocoa added in week 2, 1 teaspoon yellow maca 2 to 3 times in week 3, then build to 1 teaspoon daily if tolerated. 1/2 teaspoon coconut oil or MCT in week 4, increasing to 1 teaspoon if tolerated, and 1/4 teaspoon powdered ginger as a finishing touch. Blend each cup. Keep notes in a small journal: energy levels, mid-morning crashes, sleep, and any changes in morning firmness. Those notes tell you whether the routine is helping you. A final practical anecdote. One man I follow started with only cinnamon and cocoa because he was hesitant about oils. Within 10 days, he noticed steadier focus mid-morning and less need for a second cup. After adding small amounts of MCT and maca over the next month, he told me he felt more confident in intimate moments and was less anxious. Again, an individual response, but illustrative of the layered benefits. Before I close, 2 brief reminders. 1. Don't expect miracles overnight. Many men notice energy and circulation signals in days to 2 weeks, while sexual function improvements usually take several weeks and depend on other health factors. 2. Safety comes first. If you're on anticoagulants, diabetes medications, have liver disease, or are otherwise medically complex, check with your provider before regular use. Do not stop prescribed medications or use this drink as a substitute for your physician's advice. If you want to try it, start with the week-by-week plan I outlined. Keep your doses conservative and pay attention to how you feel. If this message is speaking to you, type yes in the comments and tell me the city you're watching from. I like seeing where viewers are tuning in from. If you found this helpful, subscribe and like for more science-informed senior health tips. And if you have questions about a specific medication interaction, leave a comment and I'll do my best to address general concerns. This information is educational and not medical advice. Consult your healthcare provider before starting any new routine, especially if you have chronic conditions or take prescription medications. Take care of your mornings and remember, small, consistent changes to what you do every day can add up to meaningful improvements in energy and circulation.